Welcome to familydoctor.expert. Today we're going to talk about travel. So why do we need to think about health issues when we're travelling? Every year in Australia we get lots of people coming back with all sorts of health issues, some of them minor, some of them serious, things like gastroenteritis, malaria, even rabies, dengue fever, all sorts of things. So we want to make sure that you have a good time and that you don't get any of these nasty diseases. So the first thing to decide is, are you going to go to your GP or do you want to go to one of these travel clinics? The travel clinics are certainly very good. They've got depth of knowledge about travel issues that's excellent. And I certainly think if you've got any complex travel needs, if you're going somewhere that's a little bit out of the way, a bit exotic, or you've got special needs, maybe you're a health worker going into do some special work, I think these clinics are very important. Remember also, some of the vaccines that are mandatory, that you have to have, can only be given by a travel clinic. So it's worth checking this out. But if you're going to sort of mainstream places and you've got basic travel needs, most GPs are pretty confident and competent to manage these problems. So what do? You go along, you tell your GP when you're going, where you're going to, and that means more than just which country you're going to, because usually the GP wants to know, are you going to be in the cities, are you going out on a tour, are you going to be out in remote and rural areas, and also if you've got any special needs, taking kids with you, if you've got older people with you, are you pregnant perhaps, what's your job, will you be doing there? Have you got any other medications that you're taking, any other medical conditions? Are you visiting family? These are all important questions. Interestingly, visiting family and friends back home overseas, people think, I don't need to worry about all this vaccination stuff, but in fact you're at higher risk according to the studies than regular people travelling, so it is worth having a chat to your doctor. So, general advice, general things that you can do when you travel. Register with DFAT in Australia. The Department of Foreign Affairs and Trade is excellent, and they can register you and even put you on an email list to update you if there have been any changes. Bring in a list of medications. Your doctor might give you a medical letter if you're on anything that might cause concern or might even have some legal issues overseas, so that's a good idea. Can I recommend that you carry your medicines in your hand luggage, so in case your main luggage gets lost, that you've got lots of medicine. Make sure you've got travel insurance, of course. Take some spare glasses with you. Make sure any dental issues you've got are sorted. And can I suggest you get some good luggage? I see a lot of people go overseas, they hardly ever lift anything, and suddenly they're lifting these big cases, and of course they do their back when they're overseas, which is very annoying. Now, what about vaccinations? We all know about vaccinations for travel. The first thing is, make sure your routine vaccines are up to date. And we talk about that on a different familydoctor.expert video, but just to quickly recap, make sure that you're up to date with diphtheria, pertussis, that's whooping cough, and tetanus, it's called the DPT, usually given it together, and often given also with the polio vaccine, and very important to be covered for that. Most people in the current regime now are covered for Hepatitis B, but if you haven't had Hep B, it's a good idea to have it. Hepatitis is a viral infection of the liver, and it's very common. You mainly catch it from blood or from sexual activity, but you want to make sure that you're covered for that. MMR, it stands for measles, mumps, and rubella. And measles, surprisingly and worryingly, has been rearing its head again, so you want to make sure you've had your MMR vaccine as well. I highly recommend flu vaccine for my patients, particularly if they're over 65 or they have any sort of chronic disease like diabetes, heart disease, any problems like that. Just keeping in mind that flu vaccine is not recommended for the under 5-year-olds. It seems to cause a fever, febrile problem with some of the children, so it's not recommended under 5. You can talk about these with your doctor. There's some other vaccines in terms of the routine ones. Pneumococcal vaccine. This is the vaccine that helps prevent pneumonia Very important to have that if you're over 65 or you've got any other chronic diseases. There's some other good ones now. The Rotavirus vaccines, most of the kids have already had that. Very good to have that. It used to cause a lot of gastroenteritis, and the Rotavirus vaccine's been great. The chickenpox vaccine, the Varicella vaccine, is worth having. Remembering that chickenpox is very easy to catch. You can get it from respiratory exposure, so that's worth getting done as well. Another one while you're just checking your routine vaccines is HPV, which is the vaccine which prevents cervical cancer, and all the 12 and 13-year-olds are getting that these days. Make sure that's up to date. Now we talk about the specific vaccines. So as I mentioned, some countries have a particular requirement. You need a form saying you've had it. Things like Japanese encephalitis, yellow fever, meningococcal vaccine in some African countries. So make sure that that's up to date. Now, you'll need some other vaccines, and the common ones that the GP will give you are Hepatitis A. So Hepatitis A is another liver virus that you can get from food or contaminated water, so that's a good one to have. As I mentioned, Hep B, if you haven't had it, is worth having. Typhoid vaccine comes as either tablets or an injection, and that's worth having as well. And another good one that's on the market is one for preventing cholera. This is also an oral vaccine, and these are the common ones that the GP will suggest. If not all of them, they might suggest some of them depending on where you're going, so you can have that conversation. Now, if you're doing more adventurous travel, the GP might recommend that you get vaccinated against rabies. So rabies, as we know, you get that from bites from infected animals. It's worth at least knowing that if you haven't had the rabies vaccine and you happen to get bitten, that there's a post-vaccine and an immunoglobulin that the doctors might want to give you to get rid of it. Other special vaccines, if you're going somewhere where you're at risk, are for TB, tuberculosis, or meningococcal vaccine. So all of these your doctor will consider. Now, all these vaccines potentially have side effects, and I direct you to discuss it with your doctor or to have a look at the product information. But some general things you should be aware of is any of these vaccines can give you a sort of a red, sore injection site. That's not uncommon. The doctor usually wants you to hang around for half an hour or so after you've had the vaccines, because rarely people have an anaphylactic reaction. And certainly if you notice that you're having trouble breathing or getting some swelling around your lips or your hands or your feet after a vaccine or anything else, you let your doctor know, and they'll check, make sure you're not having a reaction to the vaccine. That's quite rare, but the doctor just likes to make sure you're safe. Now, the next group of medications we need to talk about are the anti-malarials. So malaria is one of the most common diseases in the world. It's caught from getting bitten by the Anopheles mosquito, and there are tablets that you can take that help prevent it. There's a whole different range of tablets, and it's beyond the scope of today to go through all of them. So we'll just mention a couple. Doxycyline, it's an antibiotic that your doctor might recommend. There's some cautions around that one, not for pregnant ladies. It can upset your stomach. It can cause photosensitivity, so you've got to watch it in the sun, and it can interfere with the oral contraceptive pill. So you can see just with that example that there's quite a lot of things to consider when your doctor gives you one of these. There's other antimalarials. There's another one called Mefloquine. The side effect profile of that, the main problem that we're worried about is that it can tip up your mental health a little bit. So we're very reluctant to use that one for people that have got mental health problems. And there's a whole range of other antimalarials that your GP can discuss with you. Now, what about taking a travel kit? I think it's a good idea to take a travel kit. What are you going to put in it? It depends how anxious you are, but there's a few things you could take. You take some antiseptic cream, take some bandages, you might take some tweezers in there. If you're going to somewhere where there's really a lack of medical facilities, there might be a case for taking a clean pair of sterile gloves, maybe even some fresh needles or IV drips if you were going to go somewhere really remote where they don't have these things. In terms of medications, I always suggest to the patients that they have good medications in case they get traveller's diarrhoea or gastroenteritis. Pretty common, worth taking something for nausea, maybe some Maxolon or some Ondansetron. Good to take something for diarrhoea, maybe something like Loperimide. And for some patients, I'll even give them some preventive antibiotics if they get a really bad bout of gastroenteritis. These antibiotics they can take while they're away. Worth taking antifungal cream, particularly if you're going somewhere where you're using showers that you wouldn't usually use. First thing that happens, people get a tinea infection, so it's worth taking along some antifungal cream. If you get a bite, it's good to have some cortisone cream and some antihistamines to take if someone has any sort of allergic reaction. Now for women, there's a few good things to take. Depends on your situation, but not unreasonable to take some anti-thrush medication, maybe some medication for urinary tract infections would be a good idea as well. If you get painful periods, good idea to take some tablets for that. So, when you're travelling, there's a bunch of things you can do. First of all, avoid mosquito bites, and that means taking long sleeve shirts, being aware that they usually bite in the dusk, taking along or getting hold of mosquito nets for night, spraying the room with some knockdown insecticide to wipe out any mosquitoes before you go to bed. There's mosquito coils, and there's quite a few things you can do, and it's not just malaria. There are some other diseases such as dengue fever, which is also very nasty, which you can catch from mosquitoes. The second area I want to talk about while you're travelling is watching your water and your eating. So I recommend that you take along a little hand wash of some sort. Wash your hands carefully before you eat and after the toilet. Make sure that the water is either boiled or in a sealed bottle, properly sealed. Watch out for ice in drinks. Don't have fruit and vegetables that's been washed in the water. There are sterilisation tablets that you can use. You can put in the water or you can boil it to make sure it's clean. So there's a few things that you can do. For those of you who are having an adventurous trip, be careful that you don't pick up any sexually transmitted diseases. The STIs are very common, including HIV. Use condoms. Make sure that you're not at risk. So, final thing I'd like to say is if you get back and you feel sick in the days and weeks after you get back, think to yourself, have I picked something up overseas? If you're getting fever or rash or gastro or bleeding or anything that's a bit unusual or your glands are up, come along and get checked by your GP. So that all sounds pretty complicated. I'm sure you just want to hop on the plane and get out of here. If you want to be extra safe, I'm very happy to come with you as a travelling physician. I've got my sunglasses ready to go, and I'm sure my lovely wife would like to join us. So as usual, go to your doctor. Don't rely just on this video for information, and have a wonderful trip, and all the best from familydoctor.expert.